have a myriad of fillers available for patients now, made by multiple different companies. And so it is becoming a very confusing topic for patients. So when I'm visiting with somebody in the office, I try to break it down to thin, medium, and thick fillers. They can each be placed in different spots, and each company makes thin, medium, and thick fillers. So a thin filler we would use for the lips, we would use for the tear trough, and maybe some fine lines around the mouth, okay? The medium fillers we would use for the nasolabial folds, maybe this pre-gel sulcus area, and then sometimes I use them in the cheek if a person has very thin skin. For the thicker fillers, temple, jawline, and cheek in patients with thicker skin. In addition, we can use those thick fillers for chin to help with the projection for people who don't get a chin implant but want a little bit more projection in their chin. Each company makes some in each category. Juvederm makes Volbella for their thin product, and Restylane is made by Galderma for the thin product. For the medium thickness product, you can have an RHA2 that's made with Daxxify, and then you have the Volure for also medium thickness products. For thick, you may have heard of Restylane Lift. You may have heard of Volure and Voluma. So you can use all of those different products in these different specific areas. We pick which product is best for the patient based on their skin type, their skin thickness, and their anatomy. And sometimes I may use two different brands in the same person if I think that that is what's best for them. There are so many different fillers and so many different techniques that are available. Here at JanigaMDs, we try to do the least traumatizing thing that we can for the skin. So we use a vein finder in a lot of cases in order to map the veins out on the skin so that we can, if we can see the vessels with that vein finder, then we can try to avoid them and decrease bruising. In addition, whenever we can use a cannula, which is a blunt-tipped instrument, we always try to use that. That's very important on the lower half of the face because any bruising down here can be quite significant. Obviously, we don't want any bruising, but to minimize the best that we can, we use the vein finder, we use a cannula, less trauma to the skin, avoiding as many vessels as possible. There are so many components to aging, from skin laxity to bone loss to sun damage, but the volume loss that occurs in the face is what makes us feel very hollow or heavy on the bottom and gives us that jowling. So when we're trying to replace volume in the face, we really like fillers. They are easy to use. You can have it done in the office. You can go home same day with very minimal downtime. With the fillers, we get really great results. And if there's anything that you really didn't like about it, or if you're nervous that you aren't sure that you would like to have fillers, just remember most fillers are dissolvable, and it's a great place to start. You can do small amounts, and then you can ease your way into it and get more comfortable.